Hi, my name is Dr. Lori Cayley. I am a functional medicine practitioner. I help women who have thyroid issues to reverse their thyroid conditions so that they are experiencing optimal health and can live a happy, vibrant life. And today, I want to talk to you about women who have spouses that are not necessarily supportive in their journey to reversing their thyroid condition. And I hear this a lot when I talk to women who tell me that their spouse just doesn't understand what they're going through, and oftentimes thinks that they're lazy because they're tired and fatigued, or they're gaining weight and all the other symptoms that go along with having the thyroid problem. So I just want to make a video, and this is more for spouses. So if you want to show your spouse this video so that they can understand a little bit more about what you're going through, then please do. So the first thing that you should do is actually believe what she's going through, believe what she's telling you, because women who have hypothyroidism and Hashimoto's, most women, 90% of women who have hypothyroidism, have an autoimmune condition called Hashimoto's, where their immune system is attacking their thyroid gland. And it causes symptoms like weight gain, not being able to lose weight, just dieting, exercise, whatever you would try, fatigue, extreme fatigue at times, brain fog, anxiety, depression, cold hands and feet, infertility, and many, many other symptoms. So if she's telling you that she's having these problems, believe her. If she's taking a nap at 2 or 3 o'clock in the afternoon because she's tired, it's not because she's lazy. It's because her thyroid isn't working right. If you don't have enough thyroid hormone going into the cells, you're not going to have energy. The thyroid controls metabolism. There are thyroid receptors on every cell in the body. You need thyroid hormone in the cells. If that's not happening for whatever reason that could be, then yeah, you're gonna feel like crap. So just understand that she's not making it up, and just believe her. So the other thing is also realize that thyroid medications don't fix thyroid problems. As I said, most women who have hypothyroidism, 90% have Hashimoto's. So that's an autoimmune condition. The thyroid medication doesn't do anything for the autoimmune condition. The thyroid medication is just used to change the TSH levels and T4 levels on blood work. So, but there's many other thyroid hormones that you have to take into consideration that thyroid meds don't address. Some of them address T3, but most of them that women are on don't. And the key is to find the root cause and to figure out why the immune system is overreacting, why it's attacking the thyroid gland. And that's the key, is getting to the root cause. So don't think that just because now she has thyroid medication that she should be feeling fine, because it doesn't work that way at all. And most of the time, women have to change their thyroid meds, increase the dose, and then it just, the longer it goes on, the more the immune system keeps attacking the thyroid gland, and the problem just gets worse. So you just need to find the root cause of the problem and help her. The third thing is to help her be her own health advocate. The way that things are today in our healthcare system, you can't You have to fight for yourself. You have to do your own research. You have to make sure you're getting the right thyroid test. Most doctors only test TSH levels. If the TSH level on the blood work is normal, they're going to tell you nothing's wrong with you, that you are making it up, that you should exercise more, that you should change your diet, do whatever. But they're not looking at a full thyroid panel. And they're not even looking at, they're looking at the normal results that the lab gives. And that's not how functional medicine practitioners analyze blood work, because those are sick people going to a lab to get blood work typically, and they're averaging all of the people who have gone there in the last year. Most of them are sick, so you're being compared to sick people, and we don't want, as functional medicine practitioners, our clients to be compared to sick people. We want them to be compared to people who are in optimal health, and those are the lab values that we use. Looking at everything that goes on with thyroid health, including things that are needed to make a thyroid hormone, looking at the gut and the liver to make sure they're functioning optimally, because you have to have T4 to convert to T3, which is the active hormone. And we look at gut health and we look at how your liver is functioning, and those are two main areas where T4 is converted to T3. So you have to really, be your own health advocate. If your wife or the husband should help the wife, because your wife often has brain fog and fatigue and isn't thinking clearly when going to these appointments. So help her. And also understand, a lot of decisions are made by insurance companies. So the reason that the doctors only are looking at TSH levels is because the insurance companies are telling them that's all they should be looking at. Understand that insurance isn't going to pay for what you need. When you are in this situation, you're going to have to take financial responsibility for your own health. And I hear that a lot. My husband just wants me to use my insurance. Well, your insurance isn't going to pay for the things that you need done to get your health back on track, because they don't understand where thyroid medicine has come. They're still behind the times in the traditional medical model. And using the model that I use is a more advanced model of treating thyroid conditions. And also, my last tip is just to remember that your partner, so if your wife can't do something that around the house, or try to just pitch in and help her until she could get her health back on track, and just be there for her. And like I said, understanding, listening, being supportive, those are the main things you can do. And right now I do offer free 30-minute thyroid strategy calls. I'm not sure how much longer I'm going to be able to do that in the future, just because I'm getting very, very busy. But I'm going to put the link to my calendar in this video, so that if you want to speak to me, the husband and wife, I would be glad to speak with you and explain to you, or come up with a plan to get your spouse's health back on track. So thank you for watching, and I hope to speak to you soon.